I'm a general pediatrician and a pediatric researcher. I spend a few days in clinic taking care of pediatric patients, children, all the way from birth to 18 years of age. And then the rest of my time I spend on research related to policy around newborn screening and how best to deliver care to those children. But I was interested in finding a career in medicine and research where I could study things that are related to the care we give every day. I wanted to do research in which the data we found, the studies we did, were actually changing the care we delivered at the bedside. One test that is ubiquitous, all children get, is a newborn screen. We are in the era of the genome, and we are at the point at which we could theoretically test all newborns at birth and run a sequence of their entire genome. The question is, do we really want to do that? Is that something that will give us valuable information in helping to care for them? Is that something that might give us information that could harm the child and their family? So these are questions that we need to ask now before we implement technology or testing that we do so in a way that unwittingly causes harm to these children. I spend about a third of my time in clinic caring for children and their families. And one of the most frustrating things I find in pediatrics is when a family comes to me with a problem. I know what the problem is. I can tell them what the problem is. I can tell them how best we can treat this problem, but I can't get them the care. And that's frustrating for me, and it's frustrating for the family. And access to care, especially care for behavioral health and mental health in pediatrics, is exceedingly problematic. And these are issues that I think in the next iteration of healthcare, as we now spread healthcare access to the entire United States, that we have to look at not only access to healthcare, but what that means. Having health insurance and being able to go to a doctor is important, but the type of services we deliver are also important. And behavioral health and mental health services for children and their families is very important. It's very easy in science to get into a silo. It's very easy in a big organization to get in a silo. You know, I work only with pediatricians, or I work only with pediatricians who do a certain type of research. And that can happen very insidiously. The beauty of IHPI is that it takes a multidisciplinary approach to problems of healthcare, and that's essential because these problems are complex. A doctor's not going to solve them alone. An economist is not going to solve them alone. A policy expert is not going to solve them alone. It takes people of very diverse backgrounds and expertise to solve these problems. What IHPI does is allow these individuals to come together with the resources, the infrastructure, and everything they need to talk and make changes. Recently in the area of newborn screening, we've noticed some challenges in how fast we can get the specimen from the bedside to the lab in the state and the results to the physicians who can then notify the parents of the children can then be evaluated. I've worked with some of the healthcare system engineers at IHPI, and we're trying to figure out if there's a way to model the system and figure out maybe we can make some changes to the way the blood's collected at the bedside. Maybe we can make that go faster. Maybe we can get the pickup at the hospital more frequent. Maybe that means we can get the specimen there even a half day earlier. We don't have to open the lab, and we've saved dollars and saved lives at the same time. That type of research is not possible without people that are skilled in healthcare systems, engineering, flow. And so that work is something that we're beginning to do in collaboration with the healthcare engineers here. I think one of IHPI's most important functions is to bring data to policy questions of the day. That's how we make ourselves relevant. That's how we help society. That's how we push the needle forward in health policy, in healthcare delivery. If we are not relevant, we are not important.